What's going on, everyone? It's Alex here from Alex Physio. So today we're going to be going over, do you need to wear a collar after neck surgery? Welcome. For those of you who are new to my channel, my name is Alexander Kravich. I'm a physiotherapist in Vancouver, British Columbia. Today we're going to be going over, do you actually need to wear a collar after spine surgery? So for those of you who don't know, a cervical collar or a neck brace can sometimes be worn after a surgery for your neck. Usually a surgery will be done for a radiculopathy or like a sciatica, where you have predominantly arm pain that's arising from an irritation of one of the nerves in your neck, or it can happen as a result of myelopathy where you have spinal cord compression, or of course any other red flag findings such as tumor, cancer, infection, or a fracture. There are two different routes that are taken with neck surgery. Either they go through the front or they go through the back. Some of the surgeries that are involved, there can be a discectomy where they remove a piece of the disc that's irritating the nerves or the spinal cord, a laminectomy where they take a piece of the bone out to take pressure off of the nerves, or a fusion where they fuse two or more bones together after removing a piece of the disc to limit the amount of movement that's occurring at that level to help with pain control and improve stability, using various hardware like plates and screws and the spacers in between the bones if they have removed the entire disc. With an ACDF or an anterior cervical discectomy and fusion, collars are used for the notion that it can help improve fusion rates, so the fusion of the bones following surgery, and to stimulate healing. That's kind of what the initial proposition was with regards to that. When we look at the research, I was combing through some of the literature and I found a systematic review that was done by Carey et al. In 2018 to look at whether collar use can actually improve fusion rates and surgical outcomes. Unfortunately, there are only 3 studies that compared individuals using a collar versus not using a collar after initially identifying over 900 articles. It was found that there is no strong evidence to support the use of a collar over no collar for individuals who underwent 1 or 2 level cervical neck fusions done from the front or anteriorly. Given the cost and the impact of collar use on driving, return to work and activity. Another observational study was done in 2024 by Shin et al. To ask the same question with regards to collar use versus non-use and the effect that it has on surgical outcome and fusion rates. They examined 2 cohorts of individuals who underwent ACDF surgery with and without a brace and evaluated the changes radiographically and using a pain score with regards to their outcomes for the individuals that used the collar versus the ones who didn't. And they also looked at their overall levels of functionality. There were 83 patients enrolled in the study, 38 used a collar and 45 did not. The pain score for both neck and arm pain were similar in individuals using the collar and not using the collar. Both showed statistically significant improvement from their pain scores at baseline if they used the collar and also if they didn't use the collar. There was no superiority for the amount of fusion that took place following wearing a collar or not wearing a collar as a marker of the successfulness of the surgery. As such, it was concluded that there's no superior outcome to utilizing a collar versus not utilizing a collar if you've undergone elective spine surgery from the front. Still, 55% of surgeons recommend using a collar for single-level fusions and 71% recommend using it for multi-level fusions. Despite there being some research to support that utilizing a collar can result in swallowing difficulties, inability to drive, and decrease in your functional ability to do different tasks in your day-to-day, wound healing issues, respiratory difficulty, and muscle atrophy. There can also be quite a level of discomfort with regards to using and wearing the collar based on the fit. There's also little biomechanical evidence to actually support the notion that wearing a collar can limit excessive range of motion of your neck. In addition, there's difficulty in properly fitting the collars, as there are usually 4 or 5 sizes that you need to use in order to get as close to fitting the individual as snug as possible. And of course, there's lots of variation in individuals' anatomy, and there aren't custom collars that can be ordered in a regular population within the hospital. At least from my experience, this was not a possibility for elective spine surgery. All this information that I'm mentioning is with regards to elective spine surgeries. Traumatic spine surgeries with instability would be looked at differently, and also surgeries where they go from the back. There is a little bit of differences with regards to opinion on the appropriateness of collars versus no collars. This is primarily for surgeries that are done from the front, which is more the commonly performed surgeries nowadays. Some state that when the surgeries are done from behind, and if individuals are moving their head a lot, that theoretically this can loosen some of the hardware. However, there is no research that I could find that could verify the increased likelihood of performing this if you wore a collar or if you didn't wear a collar, if you had surgery from behind. So with anterior approaches, the plates that are used are meant to act as an internal collar in and of itself, so that the outcomes from surgery can be optimized just by the changes in the surgical techniques and hardware that is being utilized nowadays versus in the past. All the evidence against the use of collars, why are spine surgeons still recommending the use of them following fusion surgeries of the neck? It makes sense theoretically that wearing a collar can act as an external cue for yourself and for those around you, pets, friends, family, from recognizing that you just had a major surgery, and to be a little bit more cautious around you so as to avoid disrupting the wound and limiting any excessive sudden movements that may be performed or irritation of the spine, versus if you didn't have a collar where you would be perceived as having no limitations or dysfunction. So sometimes just acting as that protective mechanism. Some surgeons would also recommend not necessarily wearing it 24/7, but just wearing it when you're up and about and taking it off when you're falling asleep. So there is more flexibility with regards to it versus just necessarily having to wear it 24/7. What are my thoughts? I think it's somewhere in the middle. I can appreciate both sides of the spectrum. Obviously, there's a little bit more research that seems to support that there isn't necessarily a superiority to wearing a collar versus not wearing a collar after elective spine surgery. However, sometimes depending on the patient population and the traits of the individual, sometimes a collar might just be more appropriate in their specific scenario, just to again act as that cue, protect the wound, and let you know that you need to slowly build back your tolerance and your function, and having that collar gives you some of that feedback to yourself and your friends and family around. However, it does not appear that wearing a collar is going to optimize your surgical outcome or your fusion rate or even your pain and function scores following, and there can be some of the complications that arise from it as well. I've worked at the hospital where I've seen hundreds of people fit them for a collar, and again, the tough part is the fact that there are 5 or 6 sizes that are linked to somebody's general morphology, whether or not they have short necks or long necks or more bulkier necks. But even then, some fit very well, but some fit quite poorly. And then we have individuals, or we would have cases with individuals, it would be too big for them, so they would be able to tuck their chin underneath the collar moving around, and then at that point the collar wouldn't even really be doing much. And then of course it can kind of feed into some of that fear response where individuals believe that they need to wear this collar and not move at all and be very rigid, and if they do move their neck slightly, that they're undoing all of the previous healing that had taken place and negatively affecting the surgery outcome, which again just isn't the case for elective spine surgery done from the front based on what the research says. However, we can appreciate where some people would obviously get some of those ideas and impressions. Regardless, at the end of the day, the best piece of advice is, of course, to follow the instructions of your surgeon. If you really find that if you were prescribed a collar to wear when you're up and about, and it's bothering you and it's creating skin breakdown or pressure sores or difficulty breathing or swallowing, then please chat with your spine surgeon to figure out, is there a way that we can minimize the use of this, or maybe refit it for another collar to help manage, to allow you to obviously maximize your quality of life while at the same time respecting the individual approaches of the surgeon. So chat with your spine surgeon and have a conversation with them. Of course, I'm not a spine surgeon, I'm just a physiotherapist who has had some experience with fitting collars and seeing individuals who have been having neck pain before and after surgery. So I'm aware of how the collar is maybe beneficial for some cases, but in other cases, I've found that they've sometimes done more harm than good. So follow up with your spine surgeon, ask lots of questions before surgery if you are planned for surgery in the future, to know what the expectations are. Have you had neck surgery in the past, or are you planning for neck surgery in the future? What has your experience been like overall? What are your thoughts on the collar use versus not use? Have you worn a collar after your surgery, or are you planning to wear one based on what the surgeon says? Let me know down in the comments below. Try to respond to all the comments and all the feedback that's provided as well. I'm looking forward to hearing your story and what you found that has worked and what hasn't. And if you find value in my videos, please consider checking out some of my other videos. I have almost 500 videos on various physio, exercise, and medical related topics. If you still find value, please consider subscribing to my channel. It really allows my channel to grow and allows me to reach a wider audience. I'll link below for all the articles and the citations if you want to check it out just to get a little bit more information. And until then, we'll see you in the next video. Thanks for watching.